step one is we're going to use some water and we're just gonna flush clean out from underneath of it, just where the pus and the blood is kind of dripped out today. So I have warm water and just a little wound scrubbing brush. I'm gonna get it wet and get all of that gunk out of there. Okay, step two is we're just gonna check it out. I'm just gonna push and see if any fluids come from the inside and leak out. Not much, it's looking really good. So I've already done step three, and that's to mix up our betadine solution. So because we need to flush it, we need an antibacterial liquid that can just get sprayed into the inside of that wound and get any chance of bacteria out. So our solution is betadine mixed with water. We have about 3 or 4 cups of water to maybe a tablespoon or 2 of betadine. So it should look like weak black tea. If you mix betadine solution too strong, it can kill the good cells, and if you do it too weak, it just doesn't have the properties. So this is where it gets a little gross. If you have a weak stomach, you might want to not watch this part. We actually need to get the syringe into the puncture wound and make sure that we're really flushing out the depth of it. If you can imagine, she doesn't particularly like having a syringe stuck into the hole in her neck, so. She doesn't stand super still for it, although I wouldn't expect any horse to. Whoa. Whoa. Whoa, girly. There we go. So you have to do quite a bit of it just to make sure that any chance of remaining bacteria in there gets flushed out. Her entry is in and down a little bit, which is the trickiest kind because it's a lot easier for the bacteria to fester down where the liquid would gather. The puncture wounds that go in and up will kind of naturally drain out, but you really have to be careful with the ones that have a pocket down here. When it happened originally, it was in and up, but because there's so many muscles in the chest and so much space, once air comes in, it kind of loosens that vacuum sealing that keeps it in tight, and the muscles kind of loosen a little bit. So when it happened, it really was pretty deep, and we really had to get the syringe spraying in all directions when we flushed it, and make sure we flushed underneath the skin on both sides of it. So now that we have it all clean, we're going to put in our our antibacterial ointment. So this is called Silver Sulfazine Cream. We just call it Silver. It's our favorite horse antibiotic. It's gentle on the good cells, but it's good on a whole assortment of bacteria. And this is what Betadine looks like. You can just buy this at Walmart. That's what we mixed with water for the flushing. Okay, my hands were clean before I started flushing, and I was flushing with a pretty clean solution. So now, woo. This part's a little gross, but I really just need to get it all the way in. We have to fill the bottom of her hole with silver sulfadine cream. Whoa. There we go. All right. And then one last thing, we're going to finish with Katron. This is a spray that just helps repel flies, and it's made for wounds. So, beyond her flushing twice a day, she's also on antibiotics, probiotics, and Bute. Bute is an anti-inflammatory medication in horses that just helps keep the pain and swelling down. So it happened 2 weeks ago today. It's looking really good, and we expect her to make a full recovery in the next week or two. So look forward to seeing her in lessons. It'll be just a little bit before she's completely healed, but she'll be just fine.